Cocaine, the very addictive drug that is unfortunately common to drug users. Today, the truth about cocaine will be uncovered. Ever heard of someone saying, "Give me some flake"? Did you get confused? They were talking about cocaine. There are many street names associated with cocaine, some of which are Bernie's Flakes, Big Bloke, Bernie's Gold Dust, Blanca, Crack, Flake, and Gold Dust. Cocaine is one of the worst drugs you can do. Everybody does it for a different reason. Some do it to get the deadly skinny look. A lot of people in Hollywood do this. Some people do it to numb the pain of reality, and some do it to look cool. This drug causes weight loss because of the loss of appetite. Although the drug works fast, the effects are short-lived, up to 15 minutes. These effects include the feeling of euphoria, heightened sense of hearing, and the feeling of power and energy. But of course, they last only about 15 minutes. Dopamine, the drug in cocaine, is highly addictive, and because the purpose of the effects of the drug is to build up resistance to it, larger and more frequent doses are required. This drug is also used in the medical department today as cocaine hydrochloride. It is used for medical purposes to numb the lining of the mouth, nose, and throat. It is only used by healthcare professionals and starts to work after about 1 to 2 minutes. This substance also narrows blood vessels to reduce bleeding. It is applied directly to the mouth, nose, or throat area by healthcare professionals and can be poured, sprayed, or applied with a cotton swab directly to the area. Cocaine can either be inhaled or injected. When it is inhaled through the nose, snorted, it is absorbed by the nasal tissue. When injected into the bloodstream, it is dissolved into water. Another form of cocaine is crack, which is the outcome of processed cocaine to make rock crystal that can be smoked. The crystal is heated to make vapors that absorb into the bloodstream through the lungs. When the rock is heated, it produces that crackling sound, which is where the term crack comes from. As mentioned before, the effects are intense but short-lived. This depends on the way it is introduced into the body. Injecting or smoking delivers the drug quickly into the bloodstream, which produces a stronger but shorter-lasting high than inhaling through the nose, snorting. The high from smoking can last about 5 to 10 minutes, whereas the high from snorting can last about 15 to 30 minutes. The effects of cocaine appear almost immediately after taking a single dose, but they disappear almost as fast as they come. Cocaine usually makes the user feel euphoric, energetic, talkative, and mentally alert, especially to the sensations of sight, touch, and sound when taken in small amounts. Some people say it temporarily decreases the need for food and sleep and helps them perform simple intellectual tasks more quickly, while others say otherwise. The physiological effects of cocaine use include constricted blood vessels, dilated pupils, and increased body temperature, heart rate, and blood pressure. Large amounts of cocaine usually result in bizarre, erratic, and violent behavior, but is said to intensify the user's high. It has been reported that the feelings of restlessness, irritability, anxiety, panic, paranoia, tremors, vertigo, and muscle twitches also occur. There are also severe medical complications that occur with cocaine abuse. Some of the frequent ones are cardiovascular effects, including disturbances in heart rhythm and heart attack. Neurological effects, including stroke, seizures, headaches, and coma. Sudden death can occur on the first use or unexpectedly thereafter, but it is rare. Cocaine is an extremely addictive drug, so it is unlikely that someone will reliably be able to predict or control the time that he or she will want or use the drug. This drug is so addictive that even after long periods of abstinence, the risk for relapse is still high. This was proven by a study that showed that during abstinence, the memory of cocaine use can trigger tremendous craving and relapse to drug use. This image shows the decrease of dopamine 2 receptors in the brain of a cocaine abuser versus a non-drug user. When repeated exposure to cocaine occurs, the brain starts to adapt to it and the reward pathway becomes less sensitive to the drug. In this situation, tolerance may develop. This means that higher, more frequent doses are required to feel the same intensity of the high experienced during initial use. Regularly snorting cocaine can lead to loss of smell, nosebleeds, problems with swallowing, hoarseness, and overall irritation of nasal septum, which could result in chronically inflamed, runny nose. Injected cocaine can result in reduced blood flow and loss of appetite and experience significant weight loss and malnourishment. This drug is illegal to possess and typically results in a jail sentence. In Ontario, trafficking small amounts of crack cocaine can result in sentencing range of 6 months to 2 years less a day. The conditional sentence is available for trafficking in only rare cases. A conditional sentence is a non-custodial punishment for crime. If you're involved in a dial-a-dope operation, you will generally be sentenced to incarceration. A dial-a-dope operation is where the drug dealers are contacted by phone similar to a pizza delivery service. The user will call the drug dealer and organize a meeting at a specific location. The drug dealer then sends a runner out to deliver the dope. Police are disguised as drug users, and when the runner turns up to deliver the dope, arrests are made and charges are pressed. Cocaine is the most powerful stimulant of natural origin. It is a bitter, addictive pain blocker that comes from a plant called Erythrocylin coca in South America. According to CAMH, smoking crack, with its rapid, intense, and short-lived effects, is the most addictive method of taking cocaine. When cocaine is used repeatedly at increasingly higher doses, irritability, restlessness, panic attacks, and paranoia can occur. Even a full-blown psychosis can occur, in which the person loses touch with reality and experiences auditory hallucinations.